Lysosomal acid lipase deficiency is a very rare, a very serious autosomal recessive lysosomal storage disease. It's caused by mutations in the gene that encodes lysosomal acid lipase. These mutations lead to a deficiency of the enzyme, and we've come to appreciate through work of Brown and Goldstein that this enzyme plays a critical role in cholesterol metabolism. So when the enzyme is deficient, LDL particles that bind to the LDL receptor and they get internalized, traffic to the lysosome, where normally the cholesterol esters and the triglycerides are hydrolyzed or broken down into free cholesterol and fatty acids, where they're used in energy metabolism and building other macromolecules. But when the enzyme is deficient, there's three major things that occur. There's the accumulation of these cholesterol esters and triglycerides in cells throughout the body, and that leads, one, to significant liver disease. There's the accumulation of the lipids lead to hepatomegaly, elevation in transaminases, specifically ALT and AST. This steatosis in the liver, this microvesicular steatosis, progresses very frequently to fibrosis, cirrhosis, and even liver failure, often early in life. The second major problem that occurs is the dyslipidemia caused by this defect in cholesterol metabolism. It leads to an elevated LDL cholesterol, a reduction in HDL cholesterol, and increased cardiovascular risk. And then finally, because of the accumulation of lipid in the gut, there's varying degrees of malabsorption, and you can, in the most rapidly progressive forms of the disease, have growth failure and actually die, or you can often have growth impairment. Like many lysosomal storage diseases, there's tremendous heterogeneity in this disease. The most rapidly progressive patients present in infancy with massive hepatosplenomegaly progressing quickly to liver failure. They're malnourished because they can't absorb nutrients, and they typically have growth failure and die in the first 6 months of life. But it is really a disease continuum, and we see children, adolescents, and adults with this disease, again with the same common problems with the liver disease progressing to fibrosis and cirrhosis and failure, as well as the dyslipidemia, which predisposes to cardiovascular disease. Importantly, the disease is underappreciated, and it is often confused with much more common diseases like NAFLD and NASH, or heterozygous familial hypercholesterolemia. So it's critically important for physicians to be aware of the clinical manifestations of the disease, because there's a very simple blood test, that an enzyme assay, that can diagnose this very reproducibly. The other interesting thing is, although it's a rare disease with prevalence between maybe 1 in 40,000 and 1 in 300,000, the awareness is low, and the number of patients diagnosed is less than one would predict. We also don't know everything yet about the natural history of the disease, but interestingly, we don't find many patients in their 50s and 60s or older, so either the patients are dying early, or they're not being diagnosed, or they're being misdiagnosed. So awareness of this disease is very, very important. Current treatments, our attempts at treatments, are quite lacking. They're generally supportive in nature. People have tried liver transplants and hematopoietic stem cell transplants, but they are fraught with significant morbidity, and occasionally, particularly with the stem cell transplants, mortality related to the treatment itself.